So as those cases continue to increase in Gauteng, women are regarded as the most vulnerable. That's according to the Gauteng City-Region Observatory data, which collects data and provides policy and analysis to the provincial government. To discuss this further, we're joined by the Gauteng City-Region Observatory Senior Researcher, Alexandra Parker. Very good morning to you, Alexandra. Let's start off with that fact about women. Why is that happening? What are you seeing there?
Good morning, Jane, and good morning to all the viewers. Just to correct, what we are seeing is that more women are testing positive. This has happened in the last few weeks. It's about 55% women testing positive to 45% men, and there may be a number of reasons for this. The first is that there may be more women being tested, and we don't have the testing figures. But the reason more women may be being tested is that they may be getting tested as part of pregnancy health screenings. And this is kind of corroborated by the breakdown in age. We're seeing that in the age categories 20 to 40 years old, this is where we're seeing this sort of a higher proportion of women testing positive. Other reasons why this might be the case is that we know women are more likely to be in essential services, in healthcare workers, in nursing, and also in retail. So they may be at the front lines of infection.
Okay, and what have you found out about population density and the localized risk factors that can play into this picture?
So we looked at a number of risk factors in relation to COVID-19, and we are using GCRO's quality of life survey data from 2018. That's our most recent data set. And we looked at two categories of risk. We looked at risk in terms of the transmission and the ability to implement social distancing, so risk in terms of crowding, access to sanitation, and reliance on public transport. And we also looked at risks and vulnerabilities in relation to lockdown conditions, focusing on health, people's health status, pre-existing health conditions in the household, and also income vulnerability, hunger risk, and difficulty to save money. So in terms of the sort of density, crowding is only one aspect of the risk factor, and that may occur in a number of different areas, including, in fact, some of our most dense areas in the province are in inner city areas like Hillbrow.
And how do you think this will inform disaster response planning?
So we did this analysis at the end of March, before lockdown level 5 was implemented, and it has been informing the Gauteng provincial government response from the beginning, and it's been used in modelling work that the government is doing. And so it gives a sort of overall picture of some of the risks and vulnerabilities as we understood them ahead of going into the lockdown. But as we've seen with lockdown levels 5 and 4, there are a number of current activities and events that are playing a huge role in how COVID-19 is spreading, and that's kind of largely around people's behavior. And we unfortunately don't have the current data to fully understand how that is affecting.
Okay, thanks for sharing what you have found out, though, Alexandra Parker. Thank you.